we both put ourselves through college, we both have never worked less than 2 jobs, we pay for our employer-sponsored health care, we're not on public assistance, we're not communists. And I do believe America's probably the best place in the world to live because we can have this dialogue. But I also feel that at this moment, you need to answer things better for us than you're willing to do and stay on task. So I have a healthcare question that's economic. I want you to explain to the taxpayers in this room how we are going to pay for the $20 million in increased indigent care costs when we cut $800 billion out of Medicaid that you voted to do yesterday in a direct upward transfer of wealth in tax cuts for the wealthiest Americans. Because everybody on Medicaid in Idaho, which is 18% of our population, not to mention the 83,000 Idahoans that need federal assistance to bargain and purchase their private health insurance, are still going to get sick. And when they get sick, they're going to get sicker because they won't have primary care, they won't have preventative care, and they're going to lose their jobs, they're going to lose their homes, and then they're going to end up in a $10,000 ICU stay for what could have been a $35 primary care visit and $5 worth of penicillin for their antibiotics. It's very you're playing political showdown where you appease the people that you want to appease by saying, look, we're saving all this money and we're not going to let scumbags milk Medicaid. We're going to cut Medicaid. We're going to pay for those people regardless. Do you want to pay for them to take up ICU and ER space at thousands more dollars than it would cost for people to have preventative care? We will not turn people away from ERs when they are dying.
We don't.
We don't.
Yeah.
We're paying for the health care regardless. So why wouldn't we pay for wellness benefits, primary care benefits, and to make sure that we are taking care of the most vulnerable, which happen to be the very most expensive patients to take care of. Instead, we cut $800 billion off of Medicaid that's going to a direct tax cut for the wealthiest Americans, and now we're going to be paying through the nose. So when we talk about healthcare costs being out of control, it's because people like me that have worked and stayed insured, regardless of circumstance, have to pay exorbitant costs to cover the indigent costs because now Medicaid dollars won't be flowing in. On top of that, with the majority of the state being rural, how is our economy going to absorb $20 million more in indigent costs, $800 billion across the country and drop Medicaid funds when the critical access hospitals will go away, which means our small economies will dissolve?
Yes. So let me ask you a question. We're reforming Medicaid to let the states actually do the reforms that are necessary to reduce the cost of health care. We're making it easier for the states to do the things that are necessary. If you look at Oregon, for example, they actually went ahead and increased their Medicaid. They took the money from the federal government, and what they found is that they didn't reduce the cost in indigent care and other things. In fact, their costs went up because most of the poor people ended up going to the ERs anyway. So they increased the amount of money that they were paying on the indigent, and they actually had to increase the amount of money that they were paying on the indigent. There's a report out there. It showed it it's not a Republican report. It was actually a bipartisan group that came out and said that Oregon failed in their experiment by increasing Medicaid because Medicaid and Medicare are not providing the best health care and the best ability for people to use their health care. What we want is the states to have the ability to implement changes to their healthcare system and their healthcare delivery system. And I think we can do it better. We can provide better access, and you will see reductions in the cost of healthcare.
I'd like to hear specifically how you're going to do that instead of saying things like better access. Yes. If you do not have insurance, you cannot get primary care in most communities.
So I haven't told you specifically. You just don't like my answer. But I have told you specifically. What we do is we reduce...
I'm a Medicaid patient. Now my Medicaid is gone. I need to go to a doctor, and nobody within 100 miles of me will accept a patient that cannot pay cash upfront for their services or that is on Medicaid. Explain to me what my access is. To go to the ER?
So Medicaid, people are actually, doctors are refusing Medicaid patients right now under Obamacare.
Doctors were refusing Medicaid
Right
patients
now.
long before Obamacare
But
because the
they are.
government payment rate is so low. they
Okay,
can't
so
actually
even
practice.
under Obamacare, doctors are refusing Medicaid. So don't try to blame Republicans.
I'm not trying to blame
because-
Republicans. I'm
because-
saying that the problem is if you take away health care, people cannot go to the doctor and they die.
So what the state will do is they will reduce the cost of health insurance for that 97%.
If
And we'll
you
use
don't
that
have
money.
any money to buy
Can
health
you please
insurance,
listen?
it doesn't matter.
And the 7% that don't have that insurance, then the state is going to have $130 billion is going to be divided among all the states to provide access for those people. We are going to help more people than Obamacare helps right now.
This is not a plan. You're saying, well, $130 million. What are you going to find for people?
The states are going to have to decide how to do that.
How is Iowa going to do that?
We
In the
need to
meantime,
start-
we're going to have $20 million more costs that everyone in this room needs to cover.
But what you're
How are you
saying,
going
what
to
you're
do it?
saying, Oregon, it didn't work in Oregon. What you're claiming is going to happen here already happened in Oregon under Obamacare. By increasing the cost of Medicaid, Oregon actually saw more expenses out of their coffers. So it cost them more to have Medicaid patients, and it cost them more in healthcare delivery. So
Where's the $20 million going to come from that it's going to cost us on top of what we're already paying? These are the people that will pay that.
we're going to reduce the cost for everybody.
How? How?
I just explained it to
You did
you.
not explain it. Are you going to make regions reduce their rates? Are you going to mandate that regions reduce their rates?
I don't mandate anything to agents.
You are mandating people on Medicaid except dying. You are making a mandate
No
that will
one
kill
wants
people.
anybody to die. You know, that line is so indefensible. Nobody dies because they don't have access to health care.
If you have never been in an ER at 3 in the morning explaining to a parent